Across all shifts, performance is strong. That proves experience as a driver for competence.
Greetings everyone, we are Group 1B from BSN 3C and we are here to present our research titled Attitudes on Clinical Shift Rotations and Perceived Clinical Performance Among Nursing Students.
Clinical shift rotations allow nursing students to apply theoretical knowledge in real healthcare settings. Morning and afternoon rotations influence student performance, health, energy, and learning. Existing studies mostly focus on full-time nurses, with little research on afternoon shifts and early year students.
First, SOP. What is the demographic profile of nursing students when grouped according to A, sex, B, year level, C, overall hourly grade, D, current place of residence? Next, what are the attitudes of nursing students toward clinical shift rotations in terms of A, morning shifts, B, afternoon shift? Next, what is the perceived level of clinical performance among nursing students during the following rotation schedule? A, morning shifts, B, afternoon shift. Next, is there a significant relationship between nursing students' attitude toward clinical shift rotation in terms of the following rotation schedule and the aforementioned demographic profile? A, morning shifts, B, afternoon shifts. Next, is there a significant relationship between nursing students' perceived clinical performance during the following shift rotation and A, morning shifts, B, afternoon shifts? Next, is there a significant relationship between the students' attitudes toward clinical shift rotation and their perceived clinical performance? A, morning shift, B, afternoon shifts. Next, is there a significant difference between nursing students' attitudes toward clinical shift rotations in terms of following rotation schedule and aforementioned demographic profile? A, morning shift, B, afternoon shifts. Next, is there a significant difference between nursing students' perceived clinical performance during the following shift rotations and the aforementioned demographic profile? A, morning shifts, and B, afternoon shifts.
This study may be beneficial to the following: school administrators, clinical instructors, nursing students, future researchers, and parents.
For the theoretical framework, the study is grounded in two key nursing theories. One, Roy's adaptation model, and Patricia Benner's novice to expert theory.
For the conceptual framework, the demographic factors are sex, female and male, year level, third year and fourth year, hourly grade, current place of residence within Bacolod and outside Bacolod. For the framework flow, the demographics is related to attitudes toward clinical shift rotation and perceived clinical performance.
The hypothesis statement, we utilize null hypothesis.
For the research design, quantitative descriptive correlational design. Next, modified structured questionnaire as main survey tool.
For the participants, 205 nursing students, stratified random sampling use, selected via random number generation, level 3, 114 students, level 4, 91 students.
For our research instrument, it is a modified structured questionnaire with 4 parts: demographics, attitudes toward shift rotations, perceived clinical performance, and an open-ended question. It is modified with author's consent.
For the data gathering, we secured technical approval, obtained ethics clearance, requested permission, obtained informed consent, distributed questionnaire, checked and coded secured surveys.
Statistical treatment, software use, Microsoft Excel, and SPSS. For SOP1, frequency and percentage, SOP2 and 3, mean and standard deviation. SOP4 and 5, chi-square test of independence, SOP6, Perman's Raw, SOP7 and 8, Mann-Whitney U test and Kruskal-Wallis test.
Ethical consideration. Approval obtained from research panel, ethics committee, and dean of nursing. Participants selected based on inclusion criteria and oriented prior to participation. Informed consent secured. Participation was voluntary. Confidentiality and anonymity maintained. Data securely stored. Study complied with Data Privacy Act of 2012.
For the results and discussion, for the profile of the nursing students, sex, most of the participants were female, comprising of 148 students, while 57 participants were male. For the year level, most of the participants were third year with 114 individuals, while 91 participants were fourth year students. For the overall RLE grade, the overall mean is 93.64, indicating strong academic preparation while clinical competence is still developing and adaptation to clinical demands is evident. For the current location, the majority of the participants were residing within Bacolod City, totaling in 133 students, while 72 participants were living outside Bacolod City.
For attitudes towards clinical shift rotation, the morning shift's highest rated statement was this shift provides equal learning opportunities, while the lowest rated statement was my energy levels sustained during the shift. For the implication, morning shifts are learning intensive but physically demanding, requiring support in energy management and workload balance. For the afternoon shift, the highest rated statement was the shift prepares me for hospital work, while the lowest rated statement was I experience stress during the shift. Afternoon shifts are less stressful and more manageable, making them ideal for consolidation of learning, confidence builders, and clinical readiness.
For the perceived clinical performance, for the both morning shift and afternoon shift, the highest rated statement was, I follow safety protocols and infection control consistently. The lowest rated statement was, I can apply theoretical knowledge effectively. For the implication, morning shifts enhance nursing students' clinical performance, particularly in safety ethics and patient assessment due to greater exposure to clinical activities. Afternoon shifts support consistent clinical performance, more manageable and less stressful environment, allowing students to report skills, improve teamwork, and build confidence.
Relationship between attitudes and demographic profile. For morning and afternoon shift, there is no significant relationship between attitude and sex, year level, overall hourly grade, and current location. The findings suggest that nursing students' attitude toward clinical shift rotation schedules are not influenced by demographic characteristics but are more likely shaped by experiential and environmental factors within the clinical setting.
Relationship between perceived clinical performance and demographic profile. Morning and afternoon shift, no significant relationship between perceived clinical performance and sex, year level, overall hourly grade, current location. Implication: perceived clinical performance is not influenced by demographic factors, indicating that all students perform similarly regardless of background.
Relationship between attitude and perceived clinical performance. Morning and afternoon shift, there is a significant relationship between all variables. Students' attitudes significantly influence their perceived clinical performance, indicating a positive mindset enhances engagement, adaptability, and effectiveness in clinical practice. This highlights the need for educators to foster supportive environments and promote positive attitudes to improve overall clinical performance.
For the difference in nursing students' attitudes towards morning and afternoon shift rotation and group according to their demographic profile. For morning and afternoon shift, there is no significant difference between attitude and demographic profile. Application attitudes are largely shaped by shared clinical experiences, exposure, and learning environments rather than demographic or academic differences. Therefore, nursing programs should focus on strengthening clinical supervision, learning quality, and student engagement strategies.
Difference in nursing students' perceived clinical performance towards morning and afternoon shift rotation when grouped according to demographic profile. Morning and afternoon shifts, there is no significant difference between perceived and clinical performance as in sex, year level, overall hourly grade, current location. Perceived clinical performance are largely shaped by shared clinical experiences, exposure, and learning environments rather than demographic or academic differences. Therefore, nursing programs should focus on strengthening clinical supervision, learning quality, and student engagement strategies.
Conclusion, the study found that nursing students demonstrate positive attitudes and strong clinical performance regardless of demographic factors and shift schedules. Only attitude showed a significant relationship with perceived clinical performance. Overall, clinical effectiveness is more influenced by educational support and learning environment than personal characteristics, highlighting the importance of strengthening clinical teaching strategies and support systems in nursing education.
Recommendation: school administrators should balance morning and afternoon shifts to improve learning, skills development, and reduce stress and fatigue. Clinical instructors should apply shift-based teaching methods, Q&A and quick debriefing for morning shifts, and lecture discussion and case-based learning for afternoon shifts. Students should practice coping strategies like time management, stress management, rest, and procedure anticipation. Parents should provide emotional and physical support to reduce student stress. Healthcare institutions should ensure supportive clinical environments with feedback, communication, and adequate staffing. Future researchers should use larger samples, multiple institutions, and include stress, coping, and learning environment variables.